Medical Dilemma.
Hi everyone, welcome to Medical Dilemma. I'm Attorney Sarah Jane Sugitan, your host for today. Joining us in this segment is Dr. Attorney Teresita R. Sanchez, our medical legal consultant, and also Father Jerry Manlangit of the Basilica of Our Lady of Manaoag. Welcome to the show, Father Jerry.
Thank you for having me here.
Okay, so today our topic is organ donation, and I'd like to ask our guest again, Dr. Ben Puruganan, who you're connected with the National Kidney and Transplant Institute.
And some other institutions
and some
hospitals
other
also.
institutions as well, Doctor. So how long does it take for this kind of expertise to develop, for a doctor to train in organ transplant?
Well, one has to be a general surgeon first. You have to train 5 years in general surgery. Then you're going to subspecialty in transplant and vascular surgery for 3 years. So if you want to train further abroad, then it's an option for you to do that.
Okay, before we ended the first segment, I was pointing out that in driver's licenses, there is a sort of a consent form, Dr. Tess, no? Wherein you check it, if in case of a fatal vehicular accident, you can donate, you consent to donating your organs, although it does not specify what kind of organs, for example. It just says, it's just a tick box or a check box. So I understand you are instrumental in making this happen.
Yes. If I remember, it was during the time of Dr. Enrique Ona, when he was the head of the NKTI before, and we had another contact with LTO, the chief, and then we were able to devise this way of organ donation. Actually, it is not really a legal document in the sense that there are no two witnesses, which is required for a valid organ donation. But nonetheless, it has its effect. You know, it will inform the relatives of the deceased that this person is willing to donate his cornea, his kidneys, or his liver, or whatever, so that the next of kin who steps in after his death would know what his wishes are and would probably respect it. I remember in the case of a well-known actress before, the Soto family, right? And there was the mother who donated the eyes of the son, the cornea of the son. That would be nice, no? So I just want people to be worried that this is not a legal document in the sense that we have a legal donor card. I'm sure that's found in this Kidney Institute and other hospitals where they do transplantation, no? But it is not, this driver's license at the back is not really very legal.
When it comes to organ donation, and Father, I'd like to address this question to you, why does it become organ donation? Why can't it be an organ sale or an organ barter when it will incentivize our fellow Filipinos who'd like to donate their kidneys or their other organs?
Well, we have to inform that when it comes to organ donation, the word donation is different from sale. There is a significant ethical issue when it comes to organ donation. And as a matter of fact, we bioethicists had articulated some ethical, I would say, requirements in order that an organ donation or an organ transplantation may indeed be ethical. First,
what are these requirements?
We should know that there must first a serious need on the part of the recipient that cannot be fulfilled in any other way. There must be serious need, not whimsical, not capricious for that matter. Serious need for it. Kidney, for example, there's really a serious need. Second, the risk taken by the donor as an act of charity must be proportionate to the benefit that will be received by the recipient or by the donor.
Yes.
Third, that the functional integrity of the donor should never be impaired, even if anatomical integrity may suffer. Okay?
In other words, Father, if you have only one kidney, you would be disqualified
You
to
will be
donate.
disqualified.
Because
Because
unless
you'll die
cadaveric
eventually.
na, cadaveric or deceased. Pwede yun. Pero you cannot anymore donate.
a
You've
live
got only one
donor,
kidney.
yeah.
There is a functional I would say,
There will
issue
be
there.
a void, yes.
It's now well established in medicine that even if you only have one kidney, you can still live normally. The
Right.
same
You
length
can-
of longevity that
Correct.
a person.
You mean
w-
if you have only one kidney, you can
yes,
still what?
yes.
Donate?
No.
No,
No,
sorry,
But you
sorry.
can live
for
a
that.
normal
can-
life.
yes,
But you cannot donate. Following the ethical principles.
You can
that,
survive, of course.
You can survive on one
But-
kidney,
On one
but you are
kidney
not
only, yes,
qualified to
Yes,
donate.
but
Yeah,
so you can
of course you
donate
cannot,
it.
Because you will-
you cannot remove the remaining
So
kidney
following,
anymore.
Yes.
yes, the ethical principles.
Yes.
Are there any other
There
principles?
are
Father?
three more. I think that, the donee must have free and informed. In other words,
Consent.
if he gives consent, it must be free and informed. Because there are, in our culture, no,
The
family-
donee, the one receiving.
Yes, the family sometimes pressure a member of the family so that a kidney can be transplanted to a father or to a brother. There is culture.
Okay.
So it has to be free and informed.
For both sides,
Yes.
really, actually.
And then, of course, the reception of the scarce organ, like kidney, must be selected justly. That's why there must already be here for us a policy on queuing, so that no one can just be there already on the queuing line, even if he was at the last. There has to be selection, just selection, because everybody needs, and there should be no discrimination as far as this serious need is concerned. Okay, and then lastly, of course, this is a donation.
This is a donation. It's not a
Therefore,
commercial transaction.
monetary consideration must be something which should not be an issue. In other words, there must be no payment. No payment, because it will go to organ sale. Organ sale. And that is, of course, something which is immoral. Remember that you cannot trade human person or human organs. That is immoral. That's the reason why prostitution
illegal
or
likewise.
flesh trade is immoral. You cannot pay for something that comes out of you from the reverence that you must have in your body.
Yes,
Heavy.
Father's coming from an ethical perspective. Although, siguro, in a sense, if I'm going to be a policy maker, if this will encourage, for example, organ donation, maybe some policymakers, I don't know about our lawmakers, will consider incentivizing the organ donors. What do you think, Dr. Purugan?
Well, from the point of view of being a surgeon, because in actual practice, the problem comes in when the donor is not related to the recipient.
Yeah.
The first, myself, to tell them is that organ selling is not allowed. It is
It's
prohibited.
prohibited under...
So it's up to you to talk about it. It is prohibited. We'll give you, we'll examine you whether you are qualified to undergo transplantation or not. And from there, we'll recommend you to the ethics committee. Now, the members of the ethics committee will determine whether there will be a sale, whether there is ethical or moral question about these two persons who are going to have the procedure. But most of the time, we as transplant surgeon, we try to avoid, of course, we don't encourage organ selling.
Commercialization.
Because there's a law already that
It's
may
prohibited.
disqualify us, even remove our licenses, and even to the hospital license itself if we are going to violate this. But it's it's really very difficult whether this one is going to be a gift, donation, or whether it is whatever you
A barter
call it,
or
barter.
a sale.
Like, for example, if a poor man who would give his organ to a rich family, and then the rich family will give them something, is that immoral? Or the other way around, a poor recipient from a rich donor, if that poor guy will give money to the recipient, is that immoral?
Father, can you answer that,
Well,
Father?
first of all, it is a donation. No, nobody is going to stop us if we have to show our gratitude to a person who gives us a gift.
Well, the problem, Father, is whether that gift has a valuable consideration or not. when you say valuable consideration, it is against the law.
Yeah.
It's
So,
illegal.
so
Yes.
when do you say that a gift? Because a gift
It's
has
reasonable or not,
yeah,
so.
has a value also in terms of money. So when do you say that that gift could be differentiated from actual, you know,
The value.
of incentivizing, which is others don't allow.
Mm-hmm.
So it's an ethical
Yeah.
dilemma,
It's a dilemma,
to
exactly.
to transplant surgeons.
Actually, our human organs are very precious. These are but
Beyond,
these are beyond prices. Okay, even with your only single finger, for example, if you have to quantify, it's millions. If I am a rich man, well, giving let's say 10,000, 20,000 to a poor man, I don't think that will be a sale. If I have to give, I just want to be grateful to you. I am not going to sell this. It comes down to our honesty.
The
Father.
underlying
Yeah,
motive.
yeah.
Because we ourselves, in my own opinion, when you say this, is this the way when the money becomes dirty? When somebody donates somebody his organ to you, and then you give money, whatever
to the
you want to
donor.
give, either in the form of whatever.
Yes.
So
Sometimes the issue really come, but there should never
The-
be a demand from a donor. Now, I am a donor. You have to pay me or you have to give me something. There should never be something
it's
like
more,
that. Because
it should be altruistic.
that's right, altruistic. Because if there is a demand, it means that there is an exchange of. What you call
It's a
this?
transaction.
It's a
There's a
transaction.
transaction.
There's a
no?
demand.
There's a
It's no longer a
contract.
There shouldn't
donation.
be any demand at all. And as a matter of fact, even after the transplantation, there should be nothing about money or what. For example, if money comes to you, let's say you are the donor, after let's say 6 months or 1 year, should it be a payment?
Yes,
I'm
Father.
only saying to you, probably the donee wants to thank me. And actually, you can give it back if you want, so that there is no semblance of transaction for that matter. No, and if the donee will say, no, it's okay for you, just give it to your client. I'm not buying your organs. No, I'm not. As a matter of fact, I'm just giving it to you as a form
As a
of
thank
gift.
you.
Although there will always a suspicious mind. That is a
Yeah,
sale.
yes, Father. Yeah, those who are actually against it. But in actual practice, what we do is, so once we have to give to get the consent also of the donors, like that. Then we pass the responsibility to the members of the ethics committee. We are usually composed of a priest,
Right.
lawyers, social service, a kidney transplant patient, and a member of the institution. So they will decide. So if they decide otherwise, we don't do the transplant. But if they give consent, okay, you are okay, then they will sign. There is a form that they are going to sign that that you
The
can
ethics
perform the
committee
transplant,
will-
and that's the only time we do the transplant. So we give a lot of weight to what the members
Ethics
members of the transplant committee would.
So in other words, the ethics committee in any hospital is very important when it comes to organ transplant
Yes,
and
because
donation.
especially the non-related
Non-related,
to the donation,
donors.
yes, they have to undergo a series of examinations and questions.
So you're telling me, Dr. Ben, that there are actually rejections of organ transplants?
Yes,
And
yes. Ethics committee may reject the transplantation procedure itself when they establish that there's a sale. Or,
That's the number one cause for
yes.
rejection, I can imagine.
But in terms of the medical consideration, we usually do the examinations first.
First, of course.
That the donor is fit to donate and he's healthy. That even if we are going to remove one kidney, the patient should live normally, and that one kidney should compensate for the other kidney. So these are actually healthy patients. So when the transplant committee would say no, there is a doubt regarding this donation, so we don't do it
That's right.
unless they are requested to produce some papers or produce some evidence that there's no
It's
sale.
not a sale.
And the best would be a social service social service worker to go and scrutinize the donor. They even go to the house of the donor to establish the relationship between the two, because there must be an emotional relationship between the donor and the donor and the recipient. When you say that, it could be the spouse, could be their church worker, or their maid, or janitors, or drivers, or
Any
distant
relationship.
relative, or friend, a close friend.
Is there a big demand for organ donation?
Yes, of course,
Doctor,
there's
in
a
the
very big
Philippines?
demand.
But the organs
very-
are
very
very
scarce.
very scarce.
That's why very popular din yung dialysis centers, because there are those who are waiting for donors sometimes for a transplant, and they don't have. In the meantime,
They
they have to be
undergo
dialyzed.
treatment.
Well, there's a real need of organ donors. That there are a lot of sick patients who need the organs. So that's why we are encouraging not only living donation, but also
Also
the
cadaveric.
potential of getting more donor pools coming from cadaveric donors.
Doctor, when it comes to cadaveric donors, what kinds of organs can be harvested or not harvested from a
Any
cadaver?
transplantable organs like the heart,
How about
lungs,
ears? Meron
intestine.
kasama pa yan? Or
No, the
puro
cartilage,
internal?
you can get the cartilage of the ear to be transplanted to other part of those who may
So
in
heart
need of.
can be,
Yes, heart can be transplanted. Intestine, pancreas,
cadaver.
liver, yes.
And
Within the
from a
bones.
live donor, as you
Oh,
said.
well, the live donor, it should be, the organ should be one that can regenerate. You can, you can remove a part of the pancreas. You can remove a part of the intestine. You can remove a part of the liver, and of course,
How about any reproductive organ? Can that be transplanted?
no,
As
that's,
far as I know, I'm an OB-GYN.
Since you put that one, that's also an issue, because we bioethicists also try to make it a point that any organ that can be transplanted should not change the personality of
There
the
you go.
recipient.
You're
This one
speaking
has
about
psychological
transgender, for
effect.
example, Father.
Sexual organ, for example, there is some psychological effect. That's why we reject such transplantation or organ donation that can change the personality of the recipient.
Of the recipient. So from an ethical perspective, that's
Yeah,
that's a
Have you ever
rejection,
done
Doctor. How
that,
about you, Doctor?
Dr. Ben? I mean,
Uh,
has there
or,
been
organ
transplants
transplant?
of
No,
the
no,
reproductive organs?
probably, yeah.
In
How
other
about
countries?
abroad?
How about abroad? In your experience?
Has it been
The,
done?
well, I think I read something that a uterus can be transplanted from one person to the
Wow,
other.
yes.
But when you say organ, like penis that
Yeah.
has been cut, if it is fresh, you can just connect it.
Yes.
Yes, and
So
even a
it's-
finger, you can just connect.
So it can be done. It's just
It
not
can be
being
done
done.
is by means of
It's because it's
microsurgery.
there are
Yeah, but
moral
uterus,
ethical
there's nothing wrong,
considerations.
because I don't think it can change the personality of the woman with just the uterus. But the
Transplant
sex
it
or the
to-
penis, for example, something different.
It will be very
it will not
obvious.
pass an
Yeah,
ethical
the
exam.
same, the
Ethical
same. If you cut somebody's penis and if it's fresh, by means of microsurgery, you try
Yeah, it can
to
be done.
reconnect. Yeah.
But ethically, it's questionable.
Oh, okay.
You don't need really that nuclear.
That is why
why it's
the first
immoral.
requirement
There's a
is there has
defect.
to be a serious need on the part of the
Yeah.
recipient,
Not
which cannot be
whimsical.
fulfilled.
In other words, dapat life-saving,
Life
Father.
saving.
Not
Yeah,
necessarily
yeah,
whimsical
organ
or
donation
Right.
is,
vanity issue.
It is a life-saving
Right.
procedure.
Basically, life-saving.
Now, let's go to the, as you said, there's a a cadaveric donor is worlds apart from a live donor, and the
Yes.
processes
Yeah, in
are
terms of,
different.
yes.
Can you elaborate, Dr. Poraganan? Why are they different, and what are the processes that make them different from each
It's just
other?
when we're cadaveric donors, these are dead persons. You can get all transplantable organs from a cadaveric donor. But of course, you have to preserve the integrity or the viability of these organs. So once you are diagnosed to be brain dead, we, the transplant team, will try to preserve the viability of these organs. So
But who determines what are the viable organs? Is it also the transplant surgeon?
it is the transplant team who will determine the viability of these organs. So we try to revive the patient. We keep the heart beating. We keep the blood pressure as normal as possible, and then that will be the best time that you are going to harvest or get these organs for transplantation, because these organs are very sensitive. So especially the liver, after 12 to 15 hours, you can no longer
It's no
use
longer
the liver,
viable.
it's no longer
So
viable.
if 12 hours,
Also the pancreas, but
also the pancreas.
kidneys, you can transplant the kidneys 24 hours after. But you have to put them in preservative solution, like in a cold solution. Yes, you keep them sterile in a very cold solution, and wait until that the recipient would come.
Do you also need to prepare the recipient for,
Yes, of course. When you are dealing with recipients who are recipients of cadaveric organs, we usually prepare them, and they should be ready to undergo the surgery
transplant.
any time of the day, any time.
They should be available.
Yeah, they should be available.
And are they also informed that the organ is going to come
Yes,
from
we
a
have,
cadaver?
we have already a waiting list of those recipients. So, for example, one patient is waiting for a kidney, one patient is waiting for. So we have a list, so we can call them anytime. So there's a donor here, cadaveric donor, and you have a good match with the donor, so you are the first priority to get the organ. So are you willing to get it? So if the patient is yes, come right away, so that in 24 hours we are going to try to do the transplantation. So they are just ready there, both medically and of course financially they should be ready.
Yes, and there's apparently a matching process. So even if you're on the priority waiting list, if
yes,
it doesn't match,
for example, we are recipients. There's already a list. Our HLA typing is already in the list, so that when you type the potential donor, you can just match them.
I see. So that's a process of matching the donor to the
So
donor.
there will be a lot of priorities from first to second or third or fourth priority. So if the first will not get, the second priority will get. Then you call the third priority and you get the fourth.
Okay, now let's go to consent, Dr. Purugaran. How do you need to obtain consent in cases of cadaveric donors? Or
Usually you get it from the nearest of kin, and most of the time it's very difficult to get a consent.
There's one
Yes,
exception
doctor.
to that, and if that is if you are a medical legal case. For example, you died in an accident, no? And because under the law it says that you can get already these organs to be transplanted. And then if you look for your next of kin and you cannot find one,
them.
they go ahead. But if the next of kin appears within a reasonable period of time, then you have to ask their permission. Otherwise, you have to return back all of those organs. Because like, for example, in the transplant of the cornea, you would need about like 12 hours. You have to preserve it right away. Otherwise, baliwala na yung cornea na yun. Sayang. So the law says medical legal cases, unfortunately. So try not to be a medical legal case.
And when we say medical legal cases,
Those
these
dying
are,
from violence, like gunshot wounds, stab wounds,
in other words,
vehicular
criminal
accidents.
cases, Doctor, victims of criminal
Victims
cases.
of violence, but not
Victims of
necessarily
violence.
criminal. Yeah.
So they can donate, or are they?
We can get it from them even without anybody's permission
Consent.
yet. Oh.
But that's good, right? I mean, you will have potential donors.
Maybe
from
the purpose is to support
encourage.
our organ donation. Yes.
Okay. How about you, Father? What do you think of consent for example, for cadaveric donors? This has, of course, we exhaust all means to locate the next of kin. What if there is no next of kin?
Well, it's the same thing with the law. We uphold and we also believe in the law that since there is no other alternative for that matter, and we are after the benefit that we can get out of that organ, then of course we can do it. We can do it. I don't think there is anything immoral or unethical in it.
Kasi sayang eh,
Yes,
the
I
organ
understand.
can be
Yeah,
have
it's
been
more on the
used.
legal aspect when it comes to this kind of medical
yes,
legal
of course.
medical legal cases. Because you try to get the consent as much as
As
possible.
much as possible.
As a matter of fact, we
However-
allow international donation, no? Because some of these, like for example, in the cornea, some of them expires without any recipient, and sayang naman. And so when there are donors, potential donees from abroad, we allow it
send
rather
the-
than waste that organ.
Yes, that organ.
That's right.
So we send the cornea abroad. I
Yes,
mean,
rather than waste it. If there's no
if
recipient,
nobody
it
if
just
nobody's
dies,
waiting
no?
here. Yes.
Oo,
So that-
sayang.
Yes, because come to think of it, although I'm conflicted, should this be an advocacy, for example? Because as you said, Dr. Puraganan, there are a lot of people on that waiting list for organs.
Yeah,
no?
it is.
But there is a scarcity when it comes to organs. But should we advocate this? Should we raise awareness so that everybody will, donate in case of, of course, when you become a cadaver, then, you don't leave that decision to your family anymore. You already predetermine it, so to speak. What do you think,
Yes,
Dr.
I think the
Puraganan?
Department of Health is now trying to improve organ donation. We have now the Philippine Network for Organ Sharing. They are trying to establish the Philippine Organ Donation and Transplant Board. And I think I am part of the technical working group in order to increase awareness and educate the people about organ donation. This has been going on for many years, but I think we need more effort and
We need
some
to raise-
financial support in order to improve organ donation, especially the cadaveric organ donation.
Yes, you said that cadaveric organ donors are different from, of course, live donors.
Yes, like
How about consent in live donor? So normally, of course, anyone who signs up to donate already is in a healthy, normal state. and
There's
can
no
give
problem
the
about
consent.
getting
It's not an
consent from.
issue.
Yes, it's not issue. The issue is whether it is ethical or not, especially when it comes to non-related donation. But when it comes to siblings, parents, and relatives, it's very easy.
Oh, what's the ethical issue in that, Dr. Puraganan? So we can ask Father Jerry here. When it comes to
Well, you have
non-related
to
living
establish
donors.
that some of the ethical issues as well as the process itself. Yes, you have to establish that it's not going to be a commercial.
It's not a commercial transaction.
Oh, yeah. No commercial transaction when it comes to siblings, relatives. No.
There should
Not
be no
much.
coercion.
Although there are still, which may also
yes,
be cultural,
undocumented cases maybe.
which may also be cultural or something psychological, for example, or emotional. As in the case, for example, a mother who would volunteer a son with Down syndrome so that the kidney can be transplanted to the father. There is an issue there.
Yeah, it's minor, no?
It's a minor.
Oo,
Or he
and
cannot give
Can
consent.
can
for
give
that matter.
consent, yeah.
There is an issue. Or, for example, well, this is a husband who needs an organ, but the wife does not consent. He wants to give it to his brother or to anyone he would like to donate, but the wife does not consent. There is an issue there.
Truly, when it comes to organ donation, there are a lot of medical and also ethical dilemmas when it comes to that. But clearly, under our law, sale of any organs is illegal and also unethical, and also it will not be allowed. But whether the ethics committee, there's an ethics committee that screens all of these, and also we learned today that there's a long waiting list for people who need organs from healthy donors. Again, thank you very much, Dr. Attorney Teresita Sanchez, Dr. Ben Puraganan, and Father Jerry Malangit for joining us in today's episode of Medical Dilemma. Join us again next week for another episode of Medical Dilemma. We'll be tackling drug addiction. This has been your host, Attorney Sarah Jane Sugitan. Thank you for watching.
Pero, ano,
Bitin
ilan?
ba?
Medical Dilemma.